Helen, as a donor representative on the panel, I mean, which is always a difficult position to be in, but I just wondered if you could tell us whether this has been a challenge for DFID to separate out the humanitarian objectives from, you know, the political or development objectives of the UK government in your own planning and programming.
Yeah, thanks, Wendy. I'm going to straight up say I definitely don't have the answers to many of the challenges that the panel's put forward today, but the evidence is very clear that the complexity in Yemen is such that, of course, it's a challenge for any donor coming into that environment to try to work out what's going on, where the needs are greatest, and what we can actually do about it, and what our partners are actually able to do about it. And one good thing from the UK side is that we have a very strong commitment and interest in Yemen, and we have made public statements at the highest levels to support our humanitarian policy in Yemen. At the outset of last year, we were in the fortunate position to be able to put together a humanitarian strategy for Yemen that was looking into the future for 2 years, and have that signed off by the Secretary of State. And it very clearly outlines the parameters of our humanitarian funding, our objectives, and our guiding principles, including DFID's humanitarian policy more broadly. Of course, it's also aiming to tackle some of the underlying development issues that have been mentioned now, but that's complicated, and our humanitarian partners are obviously navigating extremely difficult territory to get anything done, and the priorities are very much for them to respond to the most urgent needs, and where possible respond to those more challenging development issues.
Helen, thanks. I'm going to ask some of the others on the panel to talk a little bit about that, about how they think aid agencies can best navigate these competing needs and demands and priorities. Tron, do you?
Yeah, no, I think it's. I think Steve raised a very important question here, and that's being, we have a very complex and highly politicized environment that we operate in, with lots of competing priorities. And I think it's extremely important that we as humanitarians make sure that we don't take sides and follow the principles, as you said. And one of the things that we have done in the context of Yemen is that there are no donors which are part of the humanitarian country team which sets the policies and strategies for Yemen. And part of the reason why particularly the NGOs have emphasized that we should have an independent body made up of humanitarians doing this is precisely for this reason, to make sure that in an environment where there are a great deal of suspicion against foreign actors, whether they are NGOs, the UN system, what have you not, is that we're very, very clear where we're coming from, that all the assistance that we provide is based on needs, and that it happens according to the principles that we've all signed up to.
Thank you. Mikkel.
Yeah, I'll be very brief on that, just to and to follow up on Tron just comment that he just made, saying that the needs that we talk about are certainly not to be seen as needs as we see it as humanitarian organizations, but also as a response to the demand. As I mentioned earlier, programs are only safe as much as they serve the population and the political powers that they're intended to serve. And I'm mentioning, and I mentioned a little bit Amran before, to say that as long as the projects are deemed useful to the population and the stakeholders, you can work, if not safely, at least in a workable fashion. And it's the same with Aden, where our surgical facilities responds to the needs of the wounded, and that goes with contentious issues, of course. As I said, the police and the military has been at times opposing our project quite heavily. But the project still stands, and it stands because it serves the community. Parties to the conflict can bring their patients there, and that's what mostly important. The question of neutrality is extremely difficult to negotiate in Yemen. The question of independence also is difficult to negotiate. But I think that the core of the driver that makes our possible is really this question of the adequacy of our project to the needs and to the demand of the population.
Thanks, Mikhail. Salim, did you have anything you wanted to say on that point?
I mean, I would just, I think in Yemen the humanitarian crisis is very political. I mean, I think everywhere humanitarian crises are political, but this isn't a natural disaster situation. This has been a slow-burning conflict for a long, long time, and the humanitarian situation, people have been talking about it for a long time. And so the long-term solutions are political, whether we like it or not. But I also believe that most humanitarian aid agencies would not be able to operate if they were part of the political transition process because of the problems that I outlined. And I think this is a big challenge for multi-mandated NGOs. I don't have the solution, unfortunately.
Thanks very much. And Steve?
I'll just keep it brief because I'm eager to hear what the audience and other people have to say. But no, I think that what Trond mentioned in terms of what's being done to maintain that independence from the donors and to keep them out of the process is very important and a great starting point. And I guess my question comes down to also the issue of perceptions, because there's what you do and then there's how it's perceived. And when you have a context like Yemen, where not one, two, or three, but many groups around the country perceive themselves as being uniquely marginalized by the state and oftentimes by international actors as well, rightly or wrongly, oftentimes wrongly, that actually not only being independent and impartial becomes a challenge, but being perceived as such. So I think there's some further work that needs to be done in terms of how can we best communicate with various stakeholders in Yemen, from Iraq to the Houthis to many other groups and factions, that they are actually getting that the assistance is needs-based.
Thanks, Steve.
Can I just add one very
Sure.
little thing? Just to remember that since the Houthi took over part of the Amman governorate, in particular the town of Outh, where we support the health center there, we haven't had any problems. The transition has been extremely smooth, and as I briefly mentioned earlier, the political and violence that we've been talking about in Amman governance since the beginning of this event hasn't affected much our work, if at all.
Okay, that's an interesting point. Now, before we open the floor for discussion, I just wanted to go back to Helen, related to this discussion about these different perspectives. I wonder if you could tell us a little bit about DFID's shift, because you made a significant shift in terms of your approach to funding in Yemen, to multi-year funding now. And I wondered what you've seen as the advantages of doing so and how this has enabled DFID and its implementing partners to tackle some of the deeper issues in the country.
Sure. Well, yes. Last year, related to the strategy, we had a public commitment of £70 million to try to spend in Yemen to implement this strategy. It was been pretty difficult to find partners who are able to get the right staff into Yemen, who are able to get to some of the areas, Saada and Al Jawf and the outer reaches of Abiyan, where we know the needs are greatest. But DFID has pursued a strategy of trying to be flexible in conversations with our partners to find out what it is that we can do to help them with some of these challenges. Just one example is that, as many of you may be aware, the UK does like to have the branding as a sort of standard bearer in most of the partnership agreements. And in Yemen, we've been very flexible with our partners to say that if this is in any way endangering your staff in the field, then by all means don't use this. It might seem like a small thing, but it was quite a negotiation internally. So it's small successes like that I'm proud of. But yes, I mean, it seems like a very obvious solution now. But looking back, DFID had been responding to the 2011 crisis and subsequently with year-long or even less humanitarian project funding. And many of the partners were, by the time they'd sort of set up and got staff on the ground and navigated some of these tricky local dynamics to try to build trust and gain access, they were having to think about the next funding cycle already. So one of the biggest hopes with this move is that we allow people a bit more space to focus on that delivery, to focus on those local relationships, which we hope will enable better access and trust building. So that 70 million is going on until the end of 2015. We've got a number of partners implementing that across the country in some of the more difficult areas to reach and along some of the western belt of Yemen where we feel some of the needs are greatest. And we are hoping that sort of longer term planning horizon will mean that we move away from sort of business as usual, and that we see some improvements in what partners are able to achieve. However, we're more mindful than anybody about the extraordinary challenges. From my own personal experience, I managed to be based in Sana'a for 6 months of last year. Only 2 weeks of that period I was able to travel to field sites outside of Sana'a. And I'm now based in Whitehall full time, so we're operating within our own constraints of remote management, trying to understand the dynamics whilst also being very far removed. So it is a bit of a challenge, and the multi-year funding is by no means a silver bullet to the solution to humanitarian response in Yemen, but we're hoping that there may be pockets of innovation, good practice in terms of thinking about how we prepare for the inevitable conflict shocks and the natural disasters, the annual flooding seasons and whatnot, that will allow our partners to be a bit more on the front foot. But it is early days. These sorts of programs that I'm talking about have largely only been operational for the last 6 months. And so in terms of the question how much we think we're going to be able to tackle those deeper issues, it very much remains to be seen. One of DFID's decisions in this regard, given our own constraints of movement, has been to initiate third-party monitoring in Yemen, which we've done in a number of fragile, conflict-affected settings, and that will hopefully provide a means of helping us understand the local dynamics and understand what our projects are delivering on the ground and being able to report that back to the UK. But it does remain to be seen, and there will be an evaluation in due course that will tell us whether or not we've got this right or wrong.
Thanks very much, Helen.